My legs have been uncomfortable for about a year now. My right leg, I've noticed a vein bulging out. My sister went to get a vein removal treatment, and I went along and watched that whole process, and I decided to have mine checked out. So today my appointment's for a microphlebectomy, and what that is a little paper they gave me. I have a problem on the back of my knee with the veins about here, and then on the side here too. And what they said is there's 3 main veins that run down each leg, and the main one does all the work. So if you have trouble with that one, they can't do anything. But if you have trouble with the 2 side ones, they can laser treat those. That's what my sister had done. They shove a laser beam, this long tube up with a laser on the end, and they burn the veins shut. And as long as it's one of the side ones that don't do the majority of the load, you can get away with that. Anyway, all 3 of my veins were good. So what they're going to do is go in there and rip out the vein. And if you've ever seen, eating a steak and there's a chunk of vein still in it, that's what it looks like when they rip it out of your skin. The cuts are pretty small, less than 1/4 of an inch even. Pretty tiny cuts, and they don't stitch them up. And they just go in there with a hook and start pulling them out once they're done injecting them and treating them, however they do it. Anyway, so my veins have been probably set off by sitting in a chair wrong, a bad office chair. Now if you just have spider veins like that, I think they're called, those aren't covered under medical. They do those differently, but the ones I have are. And it feels like, well, first sign you have it is it feels like kind of burning. Mine did, a little burning and uncomfortable, or like you got to stretch it like a muscle cramp, or it's got a lot of different feelings you can have on the same issue. So a lot of different sensations, and they're all fairly uncomfortable. None of them are painful, like it doesn't feel like a knife in your leg or anything when you have vein problems like mine, but it's not going to get better on its own, and they seem to be getting more uncomfortable anyway. So I decided to have it done. Since there's no stitches or anything, and you're working on veins, they tell you to get this thing called a compression stocking, which is like industrial strength pantyhose, really. And they're pretty hard to get on. You slip on a little sock first, and then you pull this up. It goes all the way up to the top of your thigh and down to the heel, and it really compresses your leg and keeps it tight while your leg is healing. So these are a prescription thing, so they write you a prescription. You go to a special medical place to pick them up. Now they have you shave your legs before you go, and it took a lot longer than I thought it would. But it really helps be able to see where the problems are. Sliding doesn't show it, but there's the bulging vein there. Surgery went well. They had me lay down and gave me an IV with something that sedates you a bit. You're not unconscious, but you kind of feel like you're going in and out a little bit. But they can talk to you and ask you how you're doing anyway. So it's been about 24 hours later, and I'm going to take this off and see what it's like. Then I can take a shower and put on the compression stocking that they had. So hopefully this isn't too bad. It hasn't really been painful. I took 600 milligrams of ibuprofen once last night, but other than that, I didn't take I didn't fill this prescription that they gave me. Okay, this is tape. I don't know where the end is. Oh, it's kind of in between tape and a bandage. So the only pain that I felt a little bit of pain when they were doing it, but nothing more than, if you didn't know you were having surgery, you just think you were being poked. And then they would inject me with some more numbing agent. The pain afterward, it's really not much. This is more annoying because it restricts the blood flow to your toes. Your toes are just freezing. It's a little easier just cutting than trying to unwrap, so it's stuck onto the bandages here. The old scab and the leaks, you can see it. Well, that leak is probably a lot of the fluid they injected mixed with blood. Alright, that one came off easy. Some of these are really stuck though, and I don't want to pull because I don't want to mess around with it healing and open it up. So there we go. Very carefully. You see the black is the Sharpie marker. So when I was laying down, she knew where to cut open and all the veins to rip out. And so some of this stuff is just too stuck for me to want to pull it. So I'm going to get off as much as I can, take a shower, and hopefully with the water the rest will just fall off. Alright, this is as much as I can take off right now. This one's still leaking. It's pretty fresh blood. Some of these are darker. So can't stay in the shower too long. All of these strips stay on for 2 weeks. We'll see how this is healed up in a few days. Alright, I've had this compression stocking on all day and I absolutely hate it. It's more annoying, it seems, than the bandage wrap. I think it might have been a good idea to leave the first bandages on for a little bit longer before putting this on, but you can take this off at night. So that's what I'll do. And hopefully it's not sticking too much. Again, like right here where it's dried blood, I can't see this not turning out poorly. But I think it's going to be a pain no matter what you do, really. So 66 hours after the surgery. Seem to be okay. They're a bit itchy. I don't take showers. Seems easier just taking a bath with my leg up and out of the tub. And it's hard to know when you're overdoing it because you can walk around for a bit and it seems fine, and then all of a sudden you feel like you better go ahead and lay down because you feel like sharp pains, almost as if somebody's opening a cut. So, and it's really itchy. I don't know if it's probably just the hair all growing back, and the scars, the wound's healing, but you get super itchy. Anyway, so we'll see what it looks like in a few more days. There's just this, these little scars that should go away after a while. And the only pain that I get is like if I'm kicking snow off my shoes. So kicking a curb or a step or something, or stomping my leg to knock off some dirt or snow. Other than that, it's fine if I run, no matter what I'm doing. So it doesn't hurt to push it, nothing. So anyway, I hope that's been helpful and informative for you.